Hi there, I'm Dr. Jim at Vintage Heights Veterinary Hospital, and today we're going to talk to you about canine heartworm.
Dr. Jim, what are heartworms and how do they affect dogs?
They're a parasite that's carried by mosquitoes, and the parasite likes to live in the right side of the heart, and consequently it causes damage to the lining of the heart, and then the parasites can migrate into the lungs and cause damage to the lining of the lungs. And the adult heartworms lay little live heartworms called microfilaria that can also cause damage to the microvasculature and like the dog's kidneys and eyes and things like that with time.
How does a dog get heartworm?
Again, as I said before, it's carried by mosquitoes. A mosquito bites an infected animal like a coyote or a wolf or another dog, and then the parasite undergoes some development in the mosquito's intestinal tract. And then the mosquito gets a new blood meal. The parasite passes from the mosquito via that blood meal into the new host, which is the dog. And that parasite undergoes some tissue development and it migrates to the right side of the heart and then sets up camp there, so to speak.
What are the signs of heartworm in a dog?
Sometimes there are none. Depends on the number of heartworms and how the dog reacts to them. And other times there can be exercise intolerance, coughing, weight loss. You can just tell that something's not right. Again, it depends on the quantity of heartworms, what we call the heartworm load, and then how the dog reacts to them immunologically.
How will a veterinarian diagnose heartworm in a dog?
We draw blood. The test that we use here detects an antigen that's only present or a protein in the female heartworm. And so it's a pretty sensitive test. Is any test perfect? No, so we can miss some things. But in the previous, before that came out, in previous times, we would draw blood and actually look for the microfilaria via a filter. And like I say, just like everything else, technology has advanced and moved on.
What happens if my dog tests positive for heartworms?
We're going to retest your dog using a different test just to confirm that that's the case. If that second test comes back and confirms that your dog has heartworms, then we're going to talk to you about doing some blood tests, x-rays, EKG, and then the process of treatment, which involves medications. One of the ones that we use is called imidacide. It's been around for a long time. Those injections are given in the back in a series of 3 injections over a period of months.
What can I do to prevent my dog from getting heartworm?
Easiest thing is get them on preventative, and there's a lot of choices. HeartGuard is a once-a-month preventative. It's been around forever. Interceptor's another one. There's TriHeart. There's also a spot-on called Synergy or Revolution. And then there's an injectable called ProHeart 6 and ProHeart 6, or ProHeart 12, excuse me. And those are given, as the name kind of implies, once every 6 months or once every 12 months. And so it makes it kind of a foolproof. You don't have to remember to do it. It's already there and it just does its thing.
Are heartworm preventatives safe for dogs?
Yes, as long as they're used at the right dose and the proper intervals, you're going to be fine. Like when you give HeartGuard or Interceptor, the product does not stay in the dog more than about 24 hours. It kills a certain stage of the heartworm before it can get to the heart, and then the drug is metabolized off. Obviously, if you were to grossly overdose it, then you could have some problems. And with ProHeart 6 and ProHeart 12, it's a timed release of the drug, and again, if it's used properly and dosed properly, you do fine.
What should I do if I forget to give my dog their heartworm preventative?
As soon as you realize you've forgotten, and I've done it, don't feel bad, just okay, I'm going to give it, and then you go back to your regular schedule.
How successful is the treatment for heartworms?
Well, we use the 3 protocol treatment, 3 injections of imidacide, and it's about 98% effective. Again, nothing is perfect, but that's pretty close. There's also what they call a 2-stage protocol, and that's about 90% effective. So like I say, I figure if you're going to do this, let's go for the gusto. And so we treat with 3 injections, and like I say, it's over a period of a couple of months. So I hope you find that information helpful and useful, and if you have more questions, give us a call at Vintage Heights Veterinary Hospital, 402-489-0501. Otherwise, have a good day, and thanks for watching.